In the world we created, the rhythm of nature has changed. The climate is changing faster than our communities can adapt. The heat rising, the winds stronger, the seas rising, and the storms more devastating each year. Climate change is no longer a distant threat. It's no longer a warning. It is now woven into our daily lives right here, right now, altering our seasons, reshaping our environment, and placing every community at risk, threatening water, food, shelter, and health. With rising temperatures, we see rising dengue cases being reported. With floods, we can expect for potential clustering of waterborne diseases. And with drought comes hunger and malnutrition. And when disasters strike one after the other, typhoons, earthquakes, pandemics, floods, the challenges multiply. They do not hit us one at a time. They arrive all at once, overlapping, compounding, overwhelming. In 2020, the COVID-19 pandemic swept the entire world, bringing fear, uncertainty, and heartbreak. Thousands were ill, isolated, and grieving. In the years that followed, powerful storms struck our islands. Typhoon Odette, Typhoon Tino, tearing communities apart, leaving thousands homeless, hungry, and displaced, and worst, claiming hundreds of lives, tens missing, thousands injured, and losing our loved ones. Then the ground shook. A 6.9 magnitude earthquake claimed lives, left many injured, missing, and thousands more fearing the next tremor, shocks after shocks. For communities living in poverty, where homes are fragile, food is scarce, where jobs are unstable, where water, sanitation, and healthcare remain out of reach, a hazard becomes a crisis. The most vulnerable carry the heaviest burden. Children, the elderly, persons with disabilities, the poor. They are the ones who suffer most when disasters grow stronger and more frequent. These are the lives behind every disaster, the faces that remind us why we must act. To face these challenges, we strengthened our foundation. We institutionalized the disaster risk reduction and management in health, starting with one essential element, a plan. A clear, evidence-based, multi-hazard DRRMH plan that guides every action, every response, from the barangay to the regional level. We built stronger health emergency response teams, trained, organized, and always ready. The quad clusters unite our efforts employing a cluster approach, assessing the nutritional status of our vulnerable groups, ensuring that there is access to safe and potable water, sanitary toilets, and hygiene is promoted. And before it gets worse, we take on our victims, assess their reactions, and transform them from victims to victors and survivors. Working as one, responding as one. We ensured that life-saving commodities are ready, from emergency medicines, supplies, mobile clinics, to logistics, tents, water containers, generators, water systems, and mobility assets, all prepared, pre-positioned, accessible, and ready long before the disaster arrives. And at the heart of it all, a fully functional operations center, monitoring hazards, coordinating teams, managing data, ensuring every decision is timely, accurate, and life-saving. With DRRMH institutionalized, our response is no longer reactive. It is organized, systematic, and ensuring more lives are not sacrificed. This is more than compliance. This is transformation. From reactive to proactive. From fragmented to coordinated. From vulnerable to resilient. Communities have become active partners. They are now better prepared. Local health teams now stand stronger, better trained, better equipped, and better connected. Health workers more empowered. Institutions more capable of protecting lives. Indeed, looking into the 5K vision of kaligtasang pangkalusugan sa kalamidad sa kamay ng komunidad. Through DRRMH, we are shaping a future where shocks do not break us, they strengthen us. A future where health is protected, no matter the hazard. This is the future we envision, where every child grows up healthy, every family feels safe, and every community thrives. Where communities are built to withstand shocks, where people live with dignity, where lifelines never fail, and health systems stand firm. Where our institutions remain resilient, from barangays to hospitals, the last to fall and the first to rise.
Together we rise, together we save lives, together
we build a healthier, safer, and more resilient Central Visayas.